Good afternoon, everyone, and welcome to PTMC 2020. Let me start by re-ask to switch off your microphones. On the bottom left of your screen, you have an icon, mic, so that we can avoid feedback as much as possible. Now, I will briefly explain some rules of your virtual commands and of the conference. Regarding the rules, well, smoking might be allowed, depending on where you are. And now you can remove your masks. Social distance is not needed here, yet. Please do whatever you want with your mobile phone, as long as they don't distract you from the great content our speakers were about to share. About microphone, I said already, please switch off your microphone. About visualization. During the presentation, you can either have a view on the full stage or a specific screen. This choice can be made on the top of your screen, where you can see a command called Screen Zoom. Once you click it, you will find 3 different options, or 4 or 5, and you can choose the one you enjoy most. To have a quick overview of the stage, you can click Stage Zoom at the bottom of your screen. Now, about questions and answers, some more instructions about these. They will take place at the end of each presentation, and they will all be written. Please also avoid the raise hand you have on the bottom of your screen. Otherwise, we see the audience full of hands raised, and we cannot do too much about that. So to place your questions, you should open a new window either on your browser, in the computer, or on your mobile phone. You should go to www.slido.com. I will spell it S-L-I-D-O, Slido. And then you should enter a code. In capital letters, you should dial PTMC 2020. Once you are there in that app, you have on the top 2 options. You have polls and choose, please, questions and answers. Questions will be placed and will be selected, and you will appear in one of the screens. Speakers will do their best to answer the maximum questions. In case we run out of time, questions will be answered later by each speaker in a written way, and you'll get them on your email as long as you identify yourself. You will find a place where you can put your name and your identification. One more recommendation or request, please try not to come on the stage. We know it's not easy at the first moment to be familiar with the application, but it's quite easy to move around. And as soon as you see the stairs to the stage, you just go like that, back, okay? Last but not least, depending on if you're on a Mac or a PC, there are a lot of comments with F1, F2, F3. Some of you have already been dancing or clapping or whatever. So if your Mac has a touch bar, the function will appear on your touch bar once you press the key Fn. Otherwise, you should choose Fn plus the number. By the way, Fn plus 4 should be an applause. Now, let the conference begin. And so for that, I call Laura Ramos and Fernando Vandrés, President and Vice President, respectively, from PTMC 2020. Welcome once again and enjoy your time.
Thank you, Carla. And I want to say a special thank you. Thank you so much, Cristina Sanchez, Mara Gordon, and Dr. Ari McIlroy for being here today as our invited speakers for this special launching event. This is overwhelming. Some avatars are still lost in the campus, but in just 5 days, we had more than 400 registrations. So thank you all for coming to the first international virtual conference on medicinal cannabis. I want to also thank the amazing PTMC team that started working together back in 2017, even before medicinal cannabis was approved in Portuguese Parliament, and made possible the first conference and workshops in 2018, followed then by the second conference and workshops in 2019, in Lisbon and Porto. This team that is now here has taken my expectations above and beyond. So I will be always grateful to my dear Fernando Andrés, the Vice President of PTMC, João Costa, Luís Matias, Ana Silva, Shireen, Soraya, João Pedro, Bruno, and all the volunteers that have worked these years with us since the beginning. I want to thank also Canativa, Associação de Estudos sobre Cannabis, and the OPCM, the Portuguese Observatory for Medicinal Cannabis, that hosted our events in the previous years. We are now emancipating and creating a brand new association, but we will for sure continue to work together on our common aim, that is to improve public health and spread information about cannabis. I want to thank you also, the sponsors of previous editions, because without your support, we wouldn't be here today. We hope that we will continue to work together this year and the next coming years. I want to say a very special word as well to the patients and people that are ill or suffering right now, especially the patients in Portugal. Our journey began because of you, and we will keep on working for you. We know you need doctors with more information on medical cannabis and how to use it. So I address now to all the doctors and health professionals that are lacking information and looking for more education. We will work to support you with the reliable information and facilitate educational programs so you can stay updated with the latest scientific research. Dear patients and health professionals, please remember, you are not alone, and we will always be here to get the right people to help you. I want to also thank every member of our scientific advisory board that has more than 20 doctors and researchers from all over the world, and say a special word to Dr. Ethan Russo. In case you don't know, this all started back in January 2018, when Ethan accepted our invitation to come to Portugal and would start what PTMC is today. Without all of you, none of this would have been possible. So thank you so much for sharing the passion and the vision for the cannabis plant, its medicinal power, and spreading the information on it. Today is Earth Day. Planet Earth is wise. Our Mother Earth created plants that sure have a vital relationship with us, human beings. As humans, we all share an endocannabinoid system, and this endocannabinoid system is responsible for our homeostasis, our balance, and without it, we simply cannot survive. The PTMC aim is to let every person on this planet, every patient, every doctor, every nurse, pharmacist, psychologist, other health professionals, not forgetting legislators and lawyers, that cannabis and cannabinoids play a vital role in our human bodies. We need to change the cannabis paradigm. We are already changing it, but it takes time, and many patients don't have this time. So that's why we need to work together to make things happen shortly. In these crazy times, when we are all trying to figure out what our lives will be after the coronavirus, we needed to reinvent our strategy and enter the virtual world. Many said this is not the time, people won't like it, or elder people won't come. But even though the situation is very serious, we believe that this would have been possible. You are the living proof that we cannot stop doing what we love. We cannot lose hope. We can't stop laughing. And we absolutely need to keep having fun in whatever we do. Life is short, so please have fun while you are on this planet. Thank you again for coming. And by pressing F7, you know you can do this. Thank you again. And now I will leave Fernando Bandres, my dear partner, my dear friend, say some words about PTMC. Thank you. I hope you have a good time here.
Thank you, Laura, and thanks to everybody to be here with us. It means a lot for us. When we start this year, we have a lot of plans doing physical things, but with all this COVID situation, we should find a solution. And we found Virbela, which is a beautiful slogan that I would like to share with you, because they say, go virtual, but stay human. And that's the most important thing, to keep in touch, to talk about things that can help humanity, and cannabis indeed is one of them. So welcome again to PTMC, and I hope you enjoyed the conference. And now I give the mic again to Carla Diaz. Thank you all for coming. If you press F4, you can clap your hands. Welcome again.
Thank you, Fernando. Thank you, Laura. And it's time to welcome our first speaker, Cristina Sanchez. Cristina Sanchez obtained her PhD with distinctions in biochemistry and molecular biology at the Universidad Complutense de Madrid in 2000, after which she joined the research team of Manuel Guzman. Her research seeks to identify and observe the anti-tumor properties of cannabinoids in molecular terms, specifically in breast cancer. Current secretary and founding member of the Spanish Observatory of Medicinal Cannabis, Cristina Sanchez is also a member of the board of directors of the Spanish Society for Cannabinoid Research and vice dean of research of the School of Biology at Complutense University. With you, ladies and gentlemen, Cristina Sanchez. Welcome, Cristina.
Thank you. Let me see if I can do this from here. Hi, thank you. Thank you. I'm going to try to wave. Hello, and thank you all for being here today. I hope you and all your loved ones are safe and healthy and as happy as you can in these circumstances that we have to live all over the world. I think it's the first time that we live something like this together, and it has a lot of negative things, of course, associated to the pandemic, but it somehow connected all us, and it's really touching to see people from all over the world attending events like this one, and somehow connected through media and supporting each other. So let me check that I have control of everything here. Yes, I do. And I'm gonna make a short presentation today to talk about one of the applications, medical applications of cannabis. And our team has been working on this field for more than 20 years already. And we are convinced that we can use cannabis in cancer patients. And we can use them not only as palliative agents, but also as anti-tumoral tools. And before I start giving you or showing you results, specific results, I would like to show this slide where you can see what cancer really is. When we think about cancer, we usually think about tumoral masses, tumors growing without control in our bodies. So I was saying that in slide what I'm trying to represent is on a daily basis, and only the growth of the tumoral masses that are a danger for their lives, but also a lot of things that have a huge impact on their quality of life. Part of the slide, you can see a representation of how the disease progresses. So cancer starts with a few cells that start accumulating mutations, and they start growing without control, and they generate these tumoral masses. First stage of the disease. After this, or in parallel to this, these tumoral masses need extra food supply, and they can have that by activating a process that is called angiogenesis, or the formation of blood vessels. The way the tumoral masses, the growing tumoral masses, are fed, and that allows them to grow and grow and grow and become a danger to the bearing these tumors. And in the latest stages of the disease, have what we call metastases, creation of new tumoral masses, sites different from the original one. For example, if this tumoral mass was originated in the breast, metastases will most probably be formed in the bones or in the brain or in the liver of this cancer patient. And in fact, this last stage of the disease, metastasis, is the main cause of cancer-associated deaths. So as I was saying before, cancer patients have to deal not only with this, with the disease per se, also with the side effects of the medicines, of the drugs that they take for their tumors. For example, most of them produce nausea, vomiting, lack of appetite, or pain. And in addition to this, they also have to deal with the psychological impact of the disease, anxiety, lack of sleep. And I always say the same, but I think it's the idea of what this is for them. I'm sure everybody in the audience have suffered any of these symptoms at least once in their lifetime. About that on a daily basis. So tools for cancer patients, not only with the top part of the slide, with the progression of the disease, but also to deal with these other things that are also very important and have a very high impact on the. We know from many, many years ago that we can use cannabis to problems looking at my slides, but it's okay. So we can use cannabis to treat side effects of the chemo drugs or radiation. They use their anti-tumoral drugs. It's very well described in the scientific literature, and it has been demonstrated clinically as well, that cannabinoids are very good analgesic compounds. So, nausea, sorry, I didn't. So they're very good analgesic compounds, so they work very well against pain, and specifically against that type of pain that is refractory to opioids, and cancer pain is usually one of them. They are also very active and very at preventing nausea and vomiting induced by chemo drugs. They also stimulate appetite. And cannabinoids also can ameliorate these other effects that accompany cancer patients. Anxiety, we know that cannabinoids, and probably most prominently, are very anti-anxiety compounds. And they are also very useful for people with trouble sleeping. I'm one of them, for example. I have insomnia and I'm a cannabis user. I use cannabis. But what our group has been doing during the, not in this spectrum of effects for part of the slide. We want to know if we can cannabinoids prevent the progression of the disease per se. If we can use, in other words, cannabinoids as antitumoral agents. So when one wants to demonstrate that has a potential anti-tumor effect, a potential anti-tumoral drug, one has to demonstrate just two things, and two very simple things. The first one is that this compound or these compounds are efficacious. One, that these compounds are safe. And cannabinoids or cannabis is not an exception. To prove that cannabinoids have anti-tumoral properties, we have to prove that they are efficacious, that they can us, and also that they are safe. So we started this research. And our question was if cannabinoids produced anti-tumor responses. And we have to prove that for using these compounds in patients, we have to follow different stages. The first one, we demonstrated the anti-tumoral properties grown in plastic plates, what we call in vitro study. Once found has been demonstrated to work in cell cultures in vitro, then we move to animal models of cancer. We have different models of cancer available of different complexity, and I will guide you through slides. But by using these animal models, we have to corroborate the observations made in cell cultures. And once the properties of the compounds under study are demonstrated in animal models, then we are ready to move to experiments in animal models of cancer is what we call preclinical studies or preclinical research, which is what I do in the lab. And the studies in humans are called clinical studies, and those are done by doctors, by physicians. So in the case of cannabinoids, we started with our in vitro studies, of course, and I'm showing you in this slide a couple of images of how cancer cells look when we grow them in these petri dishes in plastic plates. On the left-hand side, you have brain tumor cells, human brain tumor cells, growing in one of these plastic plates, and all these dark dots, black dots that you see here are the nuclei of cells. So each of these dots is a cell. And as you can see here, if you don't do anything with these cells, they will grow like this, and they will conquer the whole plate. We treat these cancer cells with cannabinoids, and in this particular experiment, we use THC. What we observe is something like this, and this applies to basically all the cancer cells we have studied during these years. And is that there are very, very few alive cells remaining in the plate, and the very few ones that are still here are completely different to these ones if you compare the two pictures. In this case, they are round, refringent, and detached from the plastic plates. And all of that are signs of cell death. In other words, cannabinoids, in this case THC, are killing cancer cells. So when we observed this and we confirmed that cannabinoids could kill cancer cells in petri dishes, we then moved forward and started our studies in animal models of cancer. And we started with the most simple ones, which consist in injecting the same cancer cells that we use for our in vitro studies underneath the skin of immune deficient mice. So we inject the cells, and we can generate these masses like the one you see here in the slide, which are tumoral masses. This is a brain tumor because it's made of brain tumor cells that we generated in immune deficient mice. And when we treated the animals with cannabinoids, what we observed was what is exemplified in this mouse here on the right-hand side. As you can see, the size of the tumor that was generated is way, way smaller than the size of the animals that did not receive cannabinoid treatment. And what you see here in the bottom is these tumors when we remove them from the animals. The one coming from the mouse that didn't receive any cannabinoid treatment, and this one on the right-hand side is the one that came from the animal that received cannabinoid treatment. And as you can see, there is a significant difference in size. The one that was treated with cannabinoids was significantly smaller, but also in color. And that is telling us that the cannabinoids we used in this study were preventing not only tumor growth, but also angiogenesis, that process that I told you that was absolutely essential for the tumoral masses to grow. So this tumor is all red because it's full of blood vessels that are feeding the growing tumoral masses, while this other tumor is completely white. In other words, it doesn't have a blood supply to allow these tumoral masses to grow any further. So once we did a set of experiments in this model of cancer, it's what we call ectopic xenografts, we moved to a more physiological model of cancer because, as you can imagine, we don't have brain tumors in our backs. So when we talk about more physiological models of cancer, what we mean is to generate tumors in the same location where the cancer cells were obtained from. For example, if we are working with a brain tumor model, we will generate tumors in the brain of the animals. If we are working with breast cancer models, we will generate breast tumors in the animals. So in this case, we generated, since we were working historically, we worked with brain tumors, we decided to generate the brain tumors in the brain of the animals, not in their backs. And in this case, we worked with rats. And what you have on the left is one of the rats we used in those experiments. And we injected the tumoral cells here. And we did a scan of this animal, an MRI scan. And this white mass here is the tumor. And this is exactly the same animal in a different position. So the white mass is the tumor. And what you see on the right-hand side is the exact same rat after cannabinoid treatment. And as you can see, both here and here, there is no sign of the tumor. So again, like in the previous slide, cannabinoids were producing an antitumoral response, in this case in a more physiological model that we call orthotopic xenografts. But again, humans, we don't get tumors because someone comes and injects us with tumoral cells. Our tumors show up spontaneously. And we are lucky because we have in the lab models of cancer where the tumoral masses appear spontaneously, like in the human pathology. Luckily, we have in the lab a mouse model of breast cancer. And this is exemplified here. I'm not going to get into details to make my presentation shorter, but in summary, we have female mice that when they reach adulthood, start producing breast tumors spontaneously. We made a genetic manipulation when they are in the oocyte stage, in the earliest stages of development. And as a consequence, the females, and only the females, end up developing tumoral masses in their breasts spontaneously. This is what happens in the human pathology. And also happens in the human pathology that a big percentage of these females develop metastasis in the lungs. And as you can see, is this refringent round masses here. This is the heart of the animal, and the pink mass is the lungs, and these little balls here are the metastases, lung metastases. So again, in this model, we have spontaneous breast tumors and spontaneous lung metastases, like in the human pathology. And when we treated these animals, what we observed was, first of all, that the tumors from animals that were treated with cannabinoids had a much lower growth rate than those that did not receive cannabis treatment. In this slide here, we represent a tumor volume, the size of the tumors versus time. And as you can see, the tumors grow exponentially. But if we treat the animals with THC, you can see that the tumors grow way, way slower than in this case. But not only that, we also observed that there was a decrease in the number of tumors that the animals generated. I don't know if you are aware of this, but rodents, mouse, rats, etc., they have 10 breasts, and each one of them is susceptible of generating a tumor. And what we observed was that in the control group, the group that did not receive cannabinoid treatment, a lot of the animals had 4 or more tumors. But in the group that received THC, the cannabinoid, this number was reduced, dramatically reduced, and less than half of them had 1 tumor or more. So we were reducing not only tumor growth, but also the generation of tumors. And most important, we were also reducing with THC the generation of metastases. In this graph, we represent the percentage of animals that develop lung metastases, which is around 70% in the control population, the population of mice that did not receive cannabinoid treatment. And this number goes as low as less than 20% when the animals receive cannabinoid treatment. So in summary, in our animal studies, we observed that cannabinoids kill cancer cells, they block the angiogenesis process, and they also block the metastasis process. So the first part of the question, at least in preclinical models, is solved. Cannabinoids are effective antitumoral tools. But what about safety? Are cannabinoids safe? And to answer this question, we have to do exactly the same as we did to prove efficacy. We have to start with cancer cells grown in petri dishes, and once we demonstrate safety here, we have to move to animal models before we go to humans, to actual patients. So we started in vitro studies, and what we did, the typical experiments we do to prove that, is what you can see here. We grow a, hey, Dr. McElroy, nice to see you. So what we did in this kind of experiments was to grow cancer cells, represented here in blue and in green, and treat them with cannabinoids. And we represent here cell viability, in other words, the percentage of cells that remain alive in our dishes. And as you can see, this is 100%, and all the blue and green bars are below 100% when they are treated with THC. In other words, THC kills all these cancer cells, and these are all breast cancer cells. But if you see this graph, there is one bar, yellow one, that remains at 100% all the time. And the difference between the yellow bar and the blue and green bars is that the blue and green are cancer cells, and the yellow one are kills all these cancer cells, and these are all breast cancer cells. And as you can see, if we treat these cells with cannabinoids, we don't kill them. In other words, the anti-tumor effect or the killing effect of cannabinoids on cancer cells is selective of cancer cells and is not produced on non-tumoral cells. And this is regarding the in vitro studies. When we proved safety at this level, we moved to animal studies. And to prove safety in this case, what we do is every time we run an in vivo experiment, we collect the organs of the animals, the liver, the spleen, the lungs, the brain, everything, the bones, and we send it to a pathologist. And she makes an analysis looking for signs of toxicity. And we have never, ever found any sign of toxicity in our animals. So we can say that cannabinoids are effective anti-tumoral tools in preclinical models of cancer, and that they are also safe tools in preclinical models of cancer. But what about humans? Do we have information about efficacy and safety of cannabinoids as anti-tumoral tools in humans? Well, unfortunately, we have very, very little information so far about this. And hold on, I'm trying to make a zoom. Sorry, I'm having a problem with the Zoom. Give me a second. So, what we know from clinical studies comes just from the one and only high quality clinical study that has been performed so far to check if cannabinoids are effective anti-tumoral tools. This study has been promoted by GW Pharma, which is the company that has developed Sativex and Epidiolex. And in this study that has been performed in hospitals from the UK and Germany, they recruited glioblastoma patients. Glioblastoma is one of the most aggressive brain tumors. And they treated the patients with either temozolomide or temozolomide plus Sativex. And temozolomide is the drug that these type of patients usually receive in the clinic. And there was one arm in the study that was combined with placebo, and the other arm was combined with Sativex. You have the number of patients recruited in each of these arms, and the results of this study have not been published yet. And there are rumors out there, but please let me stress out that these are just rumors, that the results have not been published because some of these patients are still alive. But what they released in their website and have presented in a couple of meetings, scientific meetings during this last couple of years, is that the 1 year survival of these patients have statistically significantly increased. It went from 53% in the placebo group to 83%. The median survival of the patients was roughly a year in the placebo group, and went up to 550 days, and I think it's even longer now in the group that received Sativex. And something really, really important, especially for those doctors that are still scared of the side effects of cannabinoids, is that the number of patients that left this study because of the side effects was 2 in the placebo group, and exactly the same number in the Sativex group. And this is suggesting that whatever made these patients leave the study had nothing to do with the Sativex per se. That doesn't mean that Sativex doesn't have any kind of side effects. Of course, it has side effects, and they are reported here, but they are considered by the doctors involved in the study, and I can say that we can all agree in that these are minor side effects compared to the side effects of other anti-cancer therapies. So this is what we know about, this is the only study that has been done to try to prove that cannabinoids have anti-tumoral properties. So we don't have more proof of efficacy coming from this type of studies so far. But what about safety? In this case, we do have a lot of information, clinical information, suggesting that cannabinoids are safe. Well, we know that cannabinoids are safe, but coming from clinical studies, we have information also that points in the same direction. If you guys go to this website, clinicaltrials.gov, this is the site where all the clinical trials running in the world has to be registered. If you go to this site and do a search combining the terms or cannabinoids or THC or CBD, or I will show you in a minute, with cancer, you will find a big number of studies, almost 100 clinical studies, and this means thousands and thousands of patients that were cancer patients receiving anti-cancer treatments plus cannabinoid medicines, either Sativex or Marinol or Sisamed or CBD. These studies were not designed to prove efficacy of cannabinoids as anti-tumoral tools. Most of them had to do with pain. They were designed to prove that cannabinoids are effective to treat pain in cancer patients. But my point is that all of these patients were cancer patients, and none of these studies show any problem with cancer patients using cannabis in addition to their anti-tumoral treatments. In other words, we have clinical proof that cannabinoids are safe for cancer patients. So as a summary, I think I can conclude by saying that cannabinoids are effective tools, effective anti-tumor tools with anti-tumor properties in preclinical models of cancer. And we always have to keep in mind that cannabinoids have additional advantages for cancer patients. Remember that they are analgesic compounds, they stimulate appetite, they prevent nausea, vomiting, etc., etc., etc. And we know that cannabinoids are also safe tools, not only in preclinical studies, but also, and most important, in human studies. So what next? And this is my last slide. Well, next, regarding to me, my team, and all the basic researchers interested in doing preclinical research on this field, we have still many, many questions to answer, and we have decades of work ahead of us to get more information about how cannabinoids work in the context of cancer. But I think we are in a point now, in a stage where what we need is clinical studies. I love my work, and I will be happy to be working on this field for another 20 years. But we need clinical trials like the one performed by GW. Clinical studies are also observational studies and all sorts of publications that you can make out of the information that you collect from your patients. So the call is, please, doctors, collect that information, put it together in a paper, and try to publish it, because as you know, that's the only way we can convince the medical community that we're using a tool that has enormous properties, therapeutic properties for cancer patients. Thank you very much.
I believe we have a couple of questions to answer. So they will show up on the screen. May I do the first question, Cristina?
Sure, go ahead.
Okay, Dr. Sanchez, do you have any guess of which cannabinoid subclass other than THC explored for its anti-tumor? Yes?
I lost you for a few seconds, but I think what you asked was if
you have it on
cannabinoids have anti-tumor properties,
right? You have it on the first screen on the stage.
Say that again?
You have it on the first screen. Everybody can see the question on the flat screen.
Okay, I can see that now. Thank you so much.
Okay.
Well,
okay.
Yeah. Well, thank you, Carla. So that's a very interesting question. And most of the studies on the anti-tumor properties of cannabinoids have been performed with THC and CBD. But new studies are coming out. Most of them are focused now on the acid forms of cannabinoids. There are some studies with CBG, for example, cannabigerol. But some studies are trying to focus on the acid forms of cannabinoids, THCA, CBDA, CBGA, and they seem to work at least in vitro. But the amount of research that we have so far on these other cannabinoids is, I would say, less than 1% compared to what we have with THC or CBD. So we still have a lot of work to do. Did I answer the question?
Yes.
Okay. I see the question. Does smoking prevent any way the development of tumors? Well, I'm not a physician, but I would not recommend anybody to smoke, cannabis or anything to prevent any kind of tumors. If we talk about cannabinoids as potential anti-tumoral tools, smoking is definitely not the way to go. In that case, and Dr. McElroy and Mara are on the stage, and I think they are way better suited than me to answer this question. But the aim for cancer patients would be to have, if they are looking for anti-tumoral responses, okay, would be to have high levels of cannabinoids in their system, in their bodies, for as long as possible. And that is not achieved by smoking or even vaporizing. That's achieved by using oral administration of cannabinoids. The peak of the onset of the effects of cannabinoids will be longer. It will take longer to have effects, but the effects will remain longer also in the bodies. So I would not suggest anybody to smoke when facing a tumoral pathology. I would, if they are looking for anti-tumoral responses again, I would go for oral administration. And a completely different thing is if what they are looking for is relieving the pain that they are suffering, the acute pain they are suffering in a specific moment. In that case, vaporizing would be a good option because they will have the immediate relief and the effect will disappear soon. That's the only disadvantage, but that would be the way to go. Okay. So how was THC administered in mice in cancer experiments? That's also a very good question, and I'm going to make a little bit of history here. So we started doing these experiments many years ago, and we didn't know any better, and at that time we thought, okay, the closer to the tumor, the better. And we injected the cannabinoids around the tumor. When we published our first paper, one of the things the reviewers told us was that we were crazy and that kind of that route of administration was not the appropriate one, especially thinking about future application of cannabinoids in cancer. So we moved to intraperitoneal administration of cannabinoids, which would be similar to intravenous injection in humans. And that route of administration worked as effectively as the around the tumor route. But then side effects came out, and we were more aware of the way patients with cancer were using cannabis, which involved the oral route, administering cannabinoids orally. So we decided to test in our mice if by using cannabinoids through the mouth, we would have the same effects, and we did. So if you ask this question thinking about patients, my suggestion again, and I hope Dr. McElroy can confirm that later, would be to use oral cannabinoids. And I'm gonna, although nobody, well, before I go to what I was about to say, please stay away from people that recommend you to inject THC in your tumors. And please stay away from people that say that in our papers we were doing that with animals. I already explained you why we did it that way, and we would never do it again the same way. And trying to inject cannabinoids into an actual patient is a very irresponsible and dangerous thing. So please don't do that, and please stay away from people suggesting to do that. And I'm going to take the liberty of talking about another route of administration that is becoming very popular in the internet, which is a rectal administration using suppositories. And what patients say is that they can use huge amounts of THC without feeling any high. And they think that that's a very good thing because they can avoid the psychoactivity. But please think about this with me. If they are not feeling high, it's because the receptors, the CB1 receptors in the brain, are not being activated. In other words, THC is not getting to the brain. THC is not getting to the brain, it's because THC is not getting to the blood system. And if THC is not getting to the blood system, it's not getting to the tumors either. So yes, you are using a lot of THC, but the THC is not getting to the tumoral masses. And this is because the lipid absorption of the rectal mucosa is very, very, very low. So in other words, you are wasting your cannabis by using it via suppositories. I'm not saying that suppositories are not useful for certain pathologies, and in the case of cancer, for example, if the tumor is located in that area, it would be an interesting add-on therapy, but always in conjunction with oral administration. But if you have a tumor in your brain, forget about suppositories, because the THC is not going to get there, and you're going to waste a lot of product that is not anywhere in the world. Okay. So THC for apoptosis, absolutely. Terry, of course. THC produces apoptosis of cancer cells, and apoptosis is the way we biochemists have of saying cell suicide, and we and of course other groups have demonstrated that that's the main mechanism of action of anti-tumoral action of cannabinoids. THC induces apoptosis, and not only THC, CBD also produces apoptosis, not by binding to CB1 and CB2 receptors, a completely different mechanism of action, mostly the generation of reactive oxygen species, but both cannabinoids produce apoptosis. This vaporization, I would wait to prevent nausea, vomiting, and pain. I'm going to give a very short answer, and the answer would be yes, but I would prefer the doctor on the stage to answer this question. But I think he would agree with me in that vaporization is a good way to prevent nausea, vomiting, and pain.
Yes, I do agree with that, Christina, Dr. Sanchez.
Thank you, Harry. Thank you, Harry.
Was the last question. So again, your wonderful presentation, the audience for all the good questions you've placed. And now, before we go, well, maybe we can applaud. Let's applaud to Christina Sanchez again, brilliant in the presentation.
And if you let me, I have never in my life done that, but I'm gonna dance on the stage.
Go ahead, Christina. We want to see. Remember, it's F7. There
And Christina, go back to your place because you are on the left side.
Ole.
Facing back.
I'll go there and I go with you.
Okay.
Shall we go, Christina?
Thank
right
you.
Here.
Be patient. I'm gonna try.
I'm right here. Follow me. Hello? I guess you'll find the way. Well, I was saying 3 topics before we move on to the next speaker. Topics are regarding voice, screen, and some difficulties that were faced during this presentation. So, first thing is please avoid the chat. It comes with a lot of interference. Let's say if something comes up, the organization will place a message on the chat on how to solve it. Regarding the screen, some of you got the screen black. So in the top of the screen where it's been shown the presentation, you have a button to refresh. In case you get a black screen, refresh the screen. Another thing you can do, on the top right of your screen, there are these wheels. Click on the wheels. There are 2 options we should be aware of. One is to reinitialize the voice. You're facing some troubles with sound in voice, and it might solve all these issues. Last but not least, still you have some troubles getting it right and clear. On the wheels on the top right of your screen, you must choose preferences. Specializes in the development of cannabis treatment protocols for critically ill patients in California, dedicated to bringing about change in the healthcare system. Prior to Anzelder's, Gordon worked as a process engineer, helping Fortune 500 companies create intelligent software. Experience has enabled her to take a detailed and scientific approach to medical Gordon is an outspoken advocate for medical cannabis globally. She has presented at numerous medical cannabis conferences around the world and holds board positions with Zelda Therapeutics and North Bay Credit Union. F4, welcome, Maura Gordon.
Thank you.
Thank you.
I'm not sure where I'm standing. Hold on, I'm trying to find myself.
Oh, there you are.
Okay. Sorry about that, guys. I was just sitting and watching Christina's and forgot that I have to come up here. Let me do is F2 is the remote? No. There we go. There we go. I got it. Thank you so much. Okay, let me back up a little so I can see the screen. It's the main screen, right? There we go. All right, well, thank you guys so much. This is a blast. I can't believe that I'm an avatar on a screen in a group with Portugal and Madrid and all in San Francisco and audience from all over the world without having to leave the safety and comfort of our home. It's great. It's good that education continues regardless of what's going on in the world with COVID and us being required to shelter in place. Education must go on. So thank you, Laura, Fernando, Luis, and your whole team for putting this together. So what I'm going to talk about today is basically a little bit about my journey to cannabis and how I got here to this point where I'm sitting here on this virtual stage with Dr. Harry McElroy and Dr. Christina Sanchez. I'm going to leave most of the questions to the expert, as that was my goal all along. So when I first started my journey, I was taking about 26 different pharmaceuticals, and one of my significant problems is chronic pain. And the number of pains that I was being given by the medical community in the form of pharmaceuticals, everything from fentanyl patch, methadone, Neurontin, Norco, all sorts of different things. And then, of course, other drugs to counteract the side effects of those drugs, and then drugs to counteract the side effects of those, on and on and on, which I'm sure many of you have experienced either for yourselves or for your patients, depending on what your perspective is in this. So I had gotten off of all of those, and I was searching for other alternatives when a friend came to visit me, and I was sending her out to the garage to smoke because I didn't want that nasty drug in my house. But I went ahead and joined her in the garage where she was smoking a Hello Kitty pipe and with just a little bit of bud in it. And I went ahead and I took a couple of puffs off of it. And when I did, the pain I was experiencing went from about an 8 to a 2. And once I realized that this, magical little flower in this bud that's in this pipe was going to reduce my pain without having to take the pharmaceuticals, without all side effects. After my anger subsided, my doctors had not told me about this previously. I then went ahead and thought, I need to start learning about this and find out how this plant actually works. So I went to the only thing I knew how to do is I went to HempCon, which at the time, back those many years ago, was pretty much the only type of cannabis events there were, other than the every 2-year Patients at a Time conference. These were the kind of ones that were available at the time. So I went there searching for scientific and medical information, and instead I found people having a lot of fun and people wearing all sorts of body paint and having leaves covering strategic parts on their body, but not a whole lot of science. So the only thing I could do was really to go home and figure it out for myself. So I went to Oregon, which is the only place I knew anybody who grew cannabis, because even though I live right near the Emerald Triangle in California, I was so naive I didn't even know anybody who grew or used cannabis in California. which is pretty ironic when you consider that it's probably the #1 market in the world. Here's my husband next to me, and we're using the magic pan that we call it to make our first batches of infused cannabis oil here. So let's see here. So I was like, okay, if I'm going to figure out how to do this, how am I going to turn cannabis into a medicine that a doctor can recommend to me instead of recommending these horrible caustic pharmaceuticals? So the first question that needed to be answered in order to do that was that the medicine had to be lab tested. It was very important that we were able to see the cannabinoid and the terpene content of the medicine itself. It was also very important that it was free of heavy metals, free of contaminants, pesticides, molds, mildews, aflatoxins, all of that sort of thing. The second thing that we had to do is there had to be really in-depth patient intake, where the doctors were going to have to understand what it is that was wrong with the patient, but also why they're using it, how it's working, and how it's working in conjunction with all the other things that they're using. The next thing is they need to understand the effects of the cannabinoids and terpenes. So it's one thing for a doctor to understand how the physiology works and how pharmaceuticals interact in the body, but it's also important that the medical professionals understand how the different cannabinoid and terpenes and their combinations are going to affect the body, and how they're going to interact with the other pharmaceuticals that they may potentially be on. So it's very important that doctors understand, and so that they can guide their patients and meet their patients where they are, instead of having the patients hiding their cannabis use from the doctor. The next thing is there had to be specific dosing instructions. It's very important when somebody is using any kind of medication that they know how to use it and how much to take in order to have consistent, repeatable, and dependable results. You know, there's nothing worse than taking something and thinking that you're not going to have any impact or effect from it. Instead, you take it and you can't get up off the sofa, or you can't get out of bed, or your mind is so overactive that you can't relax enough to sleep. So it's very important that we have the specific dosing instructions so that each and every time you take it, you can have a predictable result. And then, of course, it's up to the patients to give the feedback. The patients must be giving the feedback to the medical professionals to use, so that you understand what's working, what's not working, and that we have enough validated data to then justify to these big pharmaceutical companies that there is enough information to justify spending the money to do a clinical trial. Because without that, it's a huge gamble to risk doing studies in cannabis. And this is one way that we can soften the risk for them. So I went and I got a whole bunch of different types of flowers, often called strains. I call them cultivars. There's mango, cotton candy diesel, Cinderella 99, headband, all sorts of them. And I had them all lab tested after making them to see what the different cannabinoid and terpene content was of each one of them, and then to start studying the different effects on how different people respond to different ones. And so once I had this information, the next thing I realized was that it's not as simple as THC and CBD, but it's a pharmacy in a flower. When you're working with cannabis, depending upon what illness you're trying to treat or what symptom you're looking to eliminate, you can pick different cultivars, different profiles of the cannabis flowers, and get completely different results. And the fact that it can treat so many different things makes it a very versatile product to have in a medicine cabinet. For example, these are just some of the things that THC and CBD alone have been shown to work for. You have, of course, your anti-cancer, anti-inflammatory, analgesic, etc. And the most common conditions that people talk about for cannabis, we call it the trifecta. You have pain, anxiety, and sleep. Pain, anxiety, and sleep. Those are the three biggest medical complaints that people have, and all three of them are very poorly managed with existing pharmaceuticals. So it's not like we're saying, oh, there's this drug out there that works great, but we think you should use cannabis instead. We're saying there aren't any good drugs out there. Here's one that does work very well. Why not give it a try? And then I want to point out the fact that cannabis is, I like to compare it to, baking a cake. You can have all your ingredients together. You can have your THC, your CBD, your beta-caryophyllene, your myrcene, your limonene, you name the different cannabinoid and terpene content. But if you take them one at a time, similar to if for your chocolate cake, if you were to eat your flour and then eat an egg and then maybe take a couple of teaspoons of cocoa, you may have had all the ingredients to make a cake, but you will not have experienced a cake, nor would you have actually eaten a cake. It's the same thing with cannabis. When you see these products that are out there where they take and they separate out all the components into isolates or distillates, and then they mix a few of them back together, or they have you take them individually, you are not going to have the benefit of the whole plant cannabis the same way that this does not equal this. Same thing. You have to have all of them together in order to have the entourage effect and the full medical benefit of the cannabinoids. So I want to talk about just for a minute what a dose is, because I said one of the components was we needed to understand how to dose. So a dose is how much and how often. Those of you in the audience who are medical professionals, you of course already know this. But when I hear people, some of the things that I hear of and what they talk about as a dose is so very different from this simple fact. A therapeutic dose, especially with cannabis, everyone is different and it requires trial and error. So it's important that you have a communication loop back and forth with your patients so that you're able to understand what their needs are, what's working for them and what's not working with them, so you can make changes. And then there's a lot of talk about microdosing. It's a term that's being used very loosely and mostly inaccurately. A microdose doesn't mean it's just a small amount. It's an amount that you don't feel, but your body does. People are saying sometimes 2-3 milligrams is a microdose, and that's just really not the case at all. And it may be that that's a therapeutic dose for somebody. So here's what's not a dose. The first thing I want to mention here is ratio. Same thing once again. I'll say to a patient, what are you taking? And they'll say, I'm taking a 1-to-1, or I'm taking a 18-to-1. Well, the problem with that is, first of all, they're not telling me which cannabinoid is first and which is second. So it's a 15-to-1. What is the 15 and what is the 1? The other thing is it doesn't tell you anything about the concentration of it. It only tells you the ratio of one cannabinoid to another. It doesn't tell me if the concentration is 30 milligrams per mil or 300 milligrams per mil or 3 milligrams per mil, all of which are going to impact when a person takes it, how much they take, of course. The second thing is the number of drops. I'll ask somebody, how much are you taking? And they'll say, I take 10 drops, or I take 5 drops. Same thing. If you don't know what the volume is, you don't know how many milligrams per milliliter, you have no way of knowing how many milligrams of cannabinoids are in an actual drop. So it's important that not only are the labeling of products done more accurately, the education of the patients to understand how to tell you what they're taking, but also that you understand how to guide your patients in knowing how to give you this information. And then this, of course, is not as nearly as big of a problem in Europe as it is in the United States, where they're not on a metric system. But I'll ask somebody how much they're taking, and they'll say they're taking 30 milliliters when they're really taking 30 milligrams, and they're taking it in 1 milliliter. One is a volume, and one of them is a weight. So it's very important that we don't confuse those. And then a therapeutic dose. If you recommend to your patient that they take 25 milligrams and they take it in 2 doses, let's say, for example, 5 in the morning and 20 in the evening, I'm using this as simply an example. This is not something for any particular diagnosis that this is being recommended, then you're going to look and say, how do we match that then to a label, to a bottle? So what I've done here is I've just taken the label off of this bottle, and I've go ahead and reproduce it here so that it's blown up for you to have ease of viewing. And what it's showing you is that, well, first of all, the rule of thumb is 1 drop is going to be approximately 1 milligram, because there's about 30 drops in a milliliter. And so that makes it about 1 milligram per drop, which makes it very easy for the purposes of this. And then to show here, how would the patient do it? They would take 5 milligrams in the morning, 5 milligrams in the evening, or 20 milligrams in the evening. And that way they would be achieving actually what is recommended from the doctor. In this case, because it is 1 milligram per drop, it'd be 5 drops in the morning, and then about 3/4 of a dropper full, which would be about 3/4 of a mil later that evening. And with that, I just want to say these are the different types of products that are out there now. There's much, much more. You have infused denatured wine, you have sodas, you have all kinds, you've got gummy bears, you've got so many different types of things now. But this is really going to give you the basic of what you see most frequently, especially in the medical side of the market. And with that, I am going to open to questions, and then I think questions probably, unless they're specific for me, I think would be best, I'll leave it to the organizers though, of course, to move to them being taken by me and Harry together. Thank you. Thank you.
Great job.
Sarah, I don't know if we have any questions right now. Let us have a look.
Okay.
So can anybody tell me if there's any question on the screen? No, we got another one for Christina. Well, I don't think so.
Okay, I have questions for Harry.
All
Sorry?
right. All right. I just wanted to say briefly while we're waiting, both those presentations were excellent, and all of the work that I've been able to do clinically really rests on the shoulders of the research that Dr. Sanchez has done, and also the just enormous amount of guidance around dosing that Mara has been focused on for so long.
Okay. So I see a question here asking if doctors prescribing specific flowers instead of pharmaceutical products looks more natural, cheaper, and better. Okay, I'm not sure why I'm getting feedback at the moment, but I would say that I don't understand the second part. But the first part, I don't see doctors recommending specific flowers. I see doctors recommending specific products the same way they would recommend a pharmaceutical. I don't recommend, because if a flower in the way that you smoke it is too unpredictable on dosing. For example, how deeply somebody inhales, how long they hold it, how long they even hold the match to the flower can all, what type of device they're using can all impact what the actual cannabinoid and terpene intake is from inhaling flower. I do see doctors, once we have some stabilization of different cultivars, potentially recommending cultivars by name. For example, saying, I want you to use 3 milligrams of an oil that's made from AC/DC, or that's made from Blue Dream, or something like that. The biggest challenge for the medical community on doing this, though, is that you have you can have the same plant growing side by side, 3 or 4 of the same cultivar, and they can have very, very different benefits to you because of the way that the sun is hitting them or the wind is hitting them, or whether they're flowers at the top of the plant or the bottom of the plant. Then you take that and you go, okay, I'm going to grow this in Portugal, and it's going to have one profile and one type of lab result. And you take that same thing and you grow it in Humboldt County in California, and it may have a very different result after it's grown because of the different growing conditions, the elevation, etc. So when you tie it to a cultivar name, it's going to be misleading because it's going to depend on that individual plant down to the lab result of that individual one and not just a generalized product. Okay.
And I wanted to piggyback on that for a second, Mara. That's something I think that we've all seen that are working with this clinically. You know, I was in Oregon about 6 weeks ago and went to a dispensary, and they had some ACDC, and the percentage was 10% of CBD, whereas in the majority of the times in California, when you encounter that in a dispensary, it's somewhere around 20 or 25%. So really, that can really be a red herring, the names of the chemovars and cultivars, and we really need to have lab tested medicine so that we know with confidence as we're going from patient to patient or batch to batch that we know that the medicine is consistent.
Right. So I think I want to ask you a question here. Well, first of all, there's a question on here about the type of extraction. The type of extraction that I recommend for people that are doing their self at home are one of two ways. You can infuse it, which isn't exactly an extraction, but you can infuse it certainly into an oil that's like I did. I recommend olive oil, number one, because it has its own medicinal benefits as well. It also absorbs the cannabinoids very effectively. We can usually get about 30 milligrams per mil of uptake into the olive oil if it's done slowly over time. And then we extract into ethanol. Now there is a device that's out there. I can't remember the name of it. Harry, I don't know if you, Dr. Harry, if you remember the name of it.
Yes, it's called the Extract Craft.
Extract Craft, yeah, and it's like just the letter X, CRAFT, or AXT, extract.
It's actually all spelled out. Extractcraft.com.
Oh, okay. Sorry. Thank you. Extractcraft.com. You can order from them. It's actually a pretty good device. You're not going to get, honey colored oil out of it, but you are going to get a real high quality oil if you have enough flowers to make extract from. Okay. And then as far as THCA and CBD in pediatrics, I can tell you that THCA, oftentimes we've had to replace CBD with THCA for children. For example, a lot of times children will be taking high dose CBD against seizures, and it'll stop working. And we found that if we then switch them to THCA, oftentimes we can get good results again. Also, THCA for autism, for a lot of the gastrointestinal issues that are associated with it, has been very, very helpful. I don't have a lot of experience personally with CBDA. I don't know if you do, Harry, if you've worked with anybody with that in particular in pediatrics.
No, not specifically. I had the same experience as you're discussing with THCA. And I think the CBDA, that's typically been when people are wanting to just add in some other cannabinoids, but we really don't have much clinical data on that in my experience thus far. Okay.
All right. So a question I want to ask you that I think is probably very important to a lot of people is, the first one is, I don't know if everywhere in the world is draconian as the United States with drug testing, but if somebody uses CBD, can they pass a drug test?
Or can they fail it? I mean, I think the answer is even when you're talking about a very low percentage of THC in some of these products, if you take enough of it, you theoretically can fail urine tox. I think it's fairly rare, but again, if you take 100 milligrams of something that's 0.3% THC and you do that repeatedly, you absolutely can develop enough of a load in your system that it will show up on a drug screen.
Right. Okay, and how about as far as interactions of cannabis with other products?
Yeah, so do you mean specifically medications?
Yes, I'm sorry, with other medicines.
Yeah, so I mean, I think in general, cannabis is very forgiving and plays well with most pharmaceuticals. That being said, it absolutely does not do well with all of them. And sometimes that's directly from an interaction, right, of the way that it's being processed through the CYP450 enzyme system, which allows for an accumulation of oftentimes like a chemotherapeutic agent in the bloodstream, which isn't inherently bad, but is something that's another reason why it's so important for all physicians, all healthcare providers involved know what the patients are taking. So there is, I have had some issues with that where I've actually seen the liver function tests, dramatically rise, and this has happened on more than one occasion. That it's pretty clear that the high dose of the cannabis, along with specific medications that have frank contraindications, that can cause a problem. The other one that's up, comes up a lot is around immunotherapy, and there was a small study in Israel, I think in 2017 at this point, that really did show that while there was no difference in mortality, the cancer cells continued to grow at a higher rate when the immunotherapy drugs are used in conjunction with cannabis, to such an extent that that's a longer conversation, but it's one specific incident that I don't recommend people using cannabis along with immunotherapy medications at this point. Again, case by case basis, but yes.
Great, thank you. That's one of the ones that people need to be the most cautious of, and it's why it's so important that they have the communication with their medical professional and not try to hide it, because it may interact with something that they're taking and have disastrous results. Okay, I see there's a lot of questions here. The evidence of CBD for bone stimulation, any recommendations in osteoporosis or bone fracture? Christina probably has papers or studies to show you, or maybe you do, Harry, on this. We've obviously been, recommending CBD to patients for years who have osteoporosis and osteopenia, and for bone healing, but I don't have any studies myself personally. I don't know what's out there that might be beneficial for this.
That's my experience as well. I mean, there were some research that showed that it actually caused an uptick in the osteoblasts, but from my understanding, there isn't any human clinical data around that. I'm not sure if Christina knows something else about that.
Yeah, I'm going to turn my mic on now. And yes, there is a study conducted in Israel, and Itai Bab is the name of the researcher that published the work. And they saw that in human fractures, the use of CBD was very beneficial because it stimulates the metabolism of osteoblasts and somehow stops the osteoclasts, which are the ones that destroy the bone. So in the bone, you have two types of cells, one that produces bone and one that destroys bone, and you have to have an equilibrium between the two of them. And what they saw was not only that the CBD was beneficial for the repair of the fractures, but also the mechanism of action involved the activation of the osteoblasts, the good guys in this case, the ones that produce bone. And
okay.
Sorry, if anybody is interested in those studies, they can drop me an email and I'll be happy to send them to them.
Yes, please. Send it to me, Christina. Okay. Is there any way to grow exactly the same product in an indoor grow? That's a very good question. What a lot of growers do is they move to something called Sea of Green, where they do very short, very quick cycle of plants, where they do like a regular rotating harvest every few days. And there seems to be more consistency. On the other hand, in an indoor grow, you're not going to have nearly the robust profile that you're going to have from, for example, light depth greenhouse, which is my preferred method. So what do I think about extracting in coconut oil? I think that that's wonderful, and we extract into coconut oil for our topical. My only reason that I say olive oil is because it seems to be tolerated in a higher volume than a lot of other oils are, and it has its own medicinal benefits. Coconut oil is one of those that, number one, there's a lot of people that are allergic to coconut, so you have to be more careful on who you administer it to. Secondly, coconut oil, when given in the volume that may be required for certain patients, may be too much and cause stomach cramps or stomach issues, which coconut oil can do. And then the last reason for it is, even though it can be shelf stable for quite a long time when refrigerated, it's difficult to keep it stable at room temperature. And and then you have to use something like medium chain triglycerides like MCT in order to keep it in a liquid form. And from the environmental standpoint, most of that's coming from red palm, which is not good for the environment. So, we don't want to be doing harm while we're doing good. Why not just go with one that's good?
And I just wanted to echo that as well, Mara. I think that, when we're talking about increasing volumes for folks that are taking higher doses or lower potency medicine, it certainly is a little more flavorful to have some more olive oil on your tongue or in your mouth than just raw coconut oil.
Yeah. Okay, are there any ethanol extraction companies that are there any CBD companies that use ethanol for extraction? Well, I have a little bit of a problem with the whole concept of what a CBD company is. If it's a company that's working with strictly hemp instead of cannabis per se, I really don't know how they're doing their extractions. I mean, we of course extract CBD using ethanol, but we do it from whole plant, where we're going through all of the rigorous requirements for any cannabis, whether it's THC or CBD or any other cannabinoid in there. And I think it's important to not separate these two out as if they should have different standards of requirements. Anything that goes in or on your body should be rigorously studied to make sure that it's safe, and that it's created correctly, that it's labeled honestly and effectively, and that you communicate what you're using to your medical professionals. Okay, some of you use extract in their belly buttons. Well, that's an interesting one. I have seen people using essential oils like on the soles of their feet when children are having seizures or they're having trouble sleeping. Sometimes mothers will rub like lavender oil and things, but this belly button is a new one for me. How about you, Dr. Harry?
Yeah, the navel isn't something that I've heard of. Absolutely putting things on the top of the head, and then frankincense specifically has been used in Ayurveda, the traditional medical system of India, where they'll take a little drop and put it on the roof of the mouth. That's a traditional use. I think it's absolutely safe. I don't know that there's clinical efficacy.
Okay. All right. Hi, Mara. Do you know any results of CBD in multiple sclerosis? Most of what I've seen in MS has been done with THC. So I'm going to ask Harry, do you know of anything in particular, Christina, of CBD for MS?
I have had some success, with a handful of patients, especially when they're having issues. MS can come in many different forms, but when they're having more issues around the muscle contractions and spasticity, I have had success with CBD being a relaxing agent that can just soothe that, along with soothing their nervous system at the same time mentally. And so, in doses typically around 50 or 100 milligrams is where I've seen the most success.
Okay. And then the last question is for Christina. Sorry, go ahead. Sorry, go ahead, Christina. Sorry.
No, I just wanted to add that one of the very, very few approved clinical uses of Sativex is spasticity associated to multiple sclerosis. And Sativex contains not only THC, but also CBD. So I don't know if, in line with Dr. Harry just said, the effect on spasticity is at least partly due to the CBD present in Sativex.
All right, thank you, Carrie and Christina. So the last question, Christina, is for you, but it's kind of one for both of us in a way. Have you compared whole plant extracts with pure THC, and if so, what were the differences?
We would like to ask maybe Dr. Paulo Tavares, is hematologist and oncologist from Coimbra. There, and if you can switch his mic and even maybe stand. Paulo Tavares, are you there? Yeah. Question, please. Yes, we don't listen. Well, okay, it will be a question for Christina. There it is, and
perfect, thank you. So, yeah, we had the opportunity to collaborate with Mara's group a couple of years ago, and that's precisely the question we were trying to address, whether the anti-tumor effect of a whole plant preparation was more potent than that of THC. And we raised this question because, as I said before, most of the studies on the anti-tumor effects of cannabinoids have been done with pure compounds, either with THC or with CBD, and more recently with other forms of cannabinoids. But most of these studies, if not all of them, were performed with pure cannabinoids. And pure cannabinoids is not what patients are usually taking. So we wanted to compare the anti-tumor efficacy of pure THC with that of a whole plant extract, whole plant preparation that was produced by Mara's group in California. So we tested both compounds, or both packs, in different models of breast cancer, of the 3 subtypes of breast cancer: hormone sensitive, HER2 positive, and triple negative. And what we observed, both in vitro, remember the cancer cells grown in petri dishes, and in vivo, in animal models of the 3 subtypes of breast cancer, are the anti-tumor efficacy. And we observed in all cases that the whole plant preparation was more effective in killing cancer cells than pure THC.
Thank you. And one of the reasons that when I selected the extract for Christina's group to study, I picked one that was a fairly average one. I made a point of not picking some, uber special extract that could never be replicated. It was just one that would be a standard one that we would use with a breast cancer patient. Interestingly enough, we had already had experience at the patient level of when they did use extracts that they got from somewhere else where they were made with a distillate or an isolate that was then, mixed together with just a few of the artificial or, other way derived terpenes, that their benefits went down considerably. So patients that had been doing well, tumors had been shrinking, side effects were being reduced, all of a sudden they weren't working anymore. The other thing is, and this is the practical part of it that is probably where I hang my hat, and that is the amount that has to be used. Cannabis is very expensive and difficult to access for most of the people in the world. And with that in mind, anything you can do, we can do to keep the price down and keep the volume that is required, the amount they need to take each day or each time, is very important. It also makes it where they can be compliant over time. So with a whole plant extract, we found that the dose required is far lower than it's what's required when they use a pure compound of just THC or CBD. And that's it. Harry, did you have anything?
No, I just wanted to say this was a real pleasure and such an innovative platform, and hope to see you all in person someday. But thanks so much.
And Harry, thank you so much. I know you're at the hospital working today. So taking your time to join us. And please be safe.
Yeah, and to you, everybody too. Stay safe and sane. Lots of love.
Well, we all know how to clap now. Whoa! That was a good one.
Bye-bye.
Well, if you allow me, I will end with that movement. But right now, it's time to appreciate all of you. Say a very big thank you all. Don't leave, because there still is a nice documentary that was done by Laura Ramos. We'll be able to see it. Hi, Laura. On my side, it was a pleasure to be on this virtual conference stage world, but anyway, things happen, learning still happens, and there are still people believing we can share knowledge. So on my side, thank you so much, PTMC, Laura, Fernando, everyone. And I guess we're going to see the documentary. It's a very rich documentary with patients that have used cannabis to their illnesses. And it's a great job. So Laura, Fernando, I leave you with a bye-bye, not bye-bye, but see you soon. Thank you so much for the invitation. Well, and I guess I need to do not dance, but at least something nice. So I'll choose this one, since also it was the first time in the stage I did it. Thank you so much. Laura, Fernando, your turn now.
I have a bit of delay. Sorry. And thank you all. I hope you had so much fun as we did. And we will see you again soon. You will hear about us. Subscribe our newsletter on our website, and stay tuned with our channels on Facebook, on YouTube. This video will be available to see after the streaming on Facebook and YouTube. And we hope to see you soon. And stay safe and take care of yourselves and take care of the others and take care of planet Earth. And with cannabis, if is possible. Thank you. Fernando?
Yeah, thanks all for coming. It was really fun to do that. I want also to apologize for any mistake with the platform. It was really a challenge to a virtual conference like this with a completely different platform, and I hope for the next one it's gonna run better for everybody. We will get used to it, but remember, always we can go virtual, but we have to stay human, and human with cannabis is always much easy. Thank you all for coming, and I hope to see you again.
And thank you, Mara, and Christina, and Ari, and Dr. Paulo from the public, and everyone. Thank you so much for coming here today. Bye-bye.
My pleasure. Bye.
If you want to do this one, you have to write on the chat slash and dance 2. Number 2, dance 2, slash dance 2.
Let's do it together.
Let's do it together, all together now.
Go.
You can all now come to the stage. Join us.
I'm gonna put now the video, and if you wanna assist, you can do it. And if you're gonna do some networking and talk or keep on dancing, we can go out of the auditorium to the beach or all around, explore the platform. And thanks to everybody. Bye.
Yo quiero danzar.